Now it's my greatest pleasure to introduce our first speaker. So I'll ask Dr. Fawn Cothran to turn on her camera and introduce. So Dr. Cothran is an assistant professor at the Family Institute at the Betty Irene Moore School of Nursing at the University of California, Davis. Her research focuses on health equity and the health of African-American dementia family caregivers, specifically caregiving stress and resilience in African-American dementia family caregivers. She's a member of the inaugural cohort of Betty Irene Moore Fellow for Nurse Leaders and Innovators, a distinguished educator in gerontological nursing education, and a fellow of the Gerontological Society of America. Dr. Cothran is also a UC Davis Center for the Advancement of Multicultural Perspectives on Science, or Campos, a scholar and a former Claire M. Fagan postdoctoral fellow with the National Hartford Centers of Gerontological Nursing Excellence. Prior to her appointment at UC Davis, she was an assistant professor at Rush University College of Nursing in Chicago. Dr. Cothran received a Bachelor of Science in Nursing from Howard University in Washington, D.C. She completed a Master's of Science Nursing with an emphasis on gerontological nursing and a Doctor of Philosophy in Nursing, both from the University of Michigan Ann Arbor. So please join me in welcoming Dr. Fawn Cothran.
Thank you so much for that introduction. And thank you so much for the invitation to speak. Good morning, everyone. I'm so excited to be. I really do appreciate the opportunity to discuss some of my work and honestly, just to participate in something that I think will be a really, really great conversation. So next slide, please. So just to give an overview today, I'm going to describe my journey and provide some background. I'll also describe my program of research with findings surrounding challenges of African-American caregiving, discussing stress and resilience, and then I'll end with some takeaway tips, some resources, and some websites. Next slide. Next slide. So I'm going to start with my journey. And so Denise was kind enough to give you a little bit of an overview, but let me explain how I got into research because this was not my plan. I started out at Howard University. I'm the first in my family to go to college. So my plan was to be a nurse. But I had an opportunity to go abroad through a partnership with the University of Illinois, Chicago. And that study abroad experience in Thailand, where I examined breast cancer among Thai women, that is what opened my eyes to decide to pursue a research career. So I moved to the Midwest, and that's the reason for this for this map here, is not only to show my journey, but just like how unpredictable life can be. So I moved to the Midwest. I attended the University of Michigan, as Denise has shared. I focused on gerontological nursing. And along the way, I continued to incorporate this experience or my expertise while working in corrections, acute care, the hospital settings, subacute care, and care transitions. And then I moved into my first faculty appointment and postdoc, as was mentioned, at Rush University in Chicago. And then to my current position where I was recruited into the Family Caregiving Institute at the Betty Irene Moore School of Nursing. So I just want you to see that it's just, I used to make jokes about how I would love to move, I'm moving farther and farther west, and literally I'm west now. Okay, next slide. So professionally, I worked with caregivers. I've always worked with caregivers, but I've actually had so much experience where caregivers were not prepared to care for family members and didn't understand the disease progression of Alzheimer's disease. And this is actually what sparked my interest in doing research with caregivers. But I want to be clear that I'm actually passionate and committed about this work because it's personal for me. Alzheimer's disease runs in my family. I watched my family share the caregiving role with my great-grandmother while I was a little girl. So it was shared between my grandfather as well as his or their 7 children. And I currently have 2 great aunts who are living with Alzheimer's. And so I continue to provide support in whatever way I can. Next slide. Next slide. So I want to start with defining some terms, which I'll do throughout my presentation, just so that we're all on the same page. And so with that, family caregiving, how I'm defining it here, is based on the AARP's definition in providing care for a family member, a partner, or a friend with chronic, disabling, or serious health condition. I think it's important to recognize that family caregiving is individually defined. And so again, we typically think about family as the biological relatives, adults, adult children, other relatives or spouses, but it's not just family from a biological sense. It can be friends, neighbors, anyone that you would consider family is what is defined as family caregiving. And a lot of folks don't always realize that they're a caregiver. And so just to be clear, sometimes caregiving does involve helping with bathing and dressing, things of that nature, but also can include helping with appointments, driving errands, taking errands, going to the grocery store, helping with medications, and financial management as well. Next slide. Now, there are well-known costs to caregiving, which would include stress, which I'll talk a little bit about later, reduced work, physical health, mental health, nutrition, sleep, as well as social isolation. But there are also benefits to caregiving, which some of the literature has talked about: sense of purpose, increased satisfaction, and opportunity to resolve conflict, as well as strengthening relationships and giving back. Next slide. So it may come as no surprise that there are many stressors in caregiving. And I know this is kind of a busy slide, but I just want to focus on some of the highlights. So some of the changes in the roles. So sometimes not having respite or relief from caregiving, juggling all of the day-to-day demands in terms of what you're doing in the decision-making, changing in living conditions, family conflict, personal care needs that change, financial, that is a huge one, as well as just, not always having the information or the skills to be able to attend to all of the specific tasks. And with that, I want to also highlight that it is not uncommon, and I really want to normalize this here, that it is not uncommon to feel a variety of emotions. So I've put some of the most common, but again, because there are positive aspects of caregiving, there are also, the rewarding, the joy, there are those pieces as well, but it is not uncommon to feel grief, denial, anger, frustration, guilt, or resentment, and sometimes all at the same time. So I just want to normalize that is also common. Next slide, please. So as I mentioned, I'll be defining some terms throughout the presentation, and one of them that I do want to pay attention to is dementia. And so this slide here just helps to bring home the point that dementia is an umbrella term. And so it isn't, what that means is, it's a catch-all term to be able to capture changes in memory, in thinking and memory that affect a person's ability to perform everyday activities. And as you can see, Alzheimer's is one type, and it is the most common type because it's that bigger drop of water under the umbrella. So I just wanted to highlight that there because a lot of times we hear dementia thrown around so much, and sometimes it's used interchangeably, but it's the catch-all term, and then there are specific types of dementia. Next slide, please. So the big thing that I want to highlight in this picture is that there are a number of family caregivers caring for someone living with Alzheimer's disease, but they are providing so many hours of unpaid care, and what that cost actually translates to. So just know that you're doing important work, and it is saving us a lot of money, but there is a toll to it too. Next slide, please. So Alzheimer's disease is the 6th leading cause of death in the US for African Americans, and they're twice as likely to have Alzheimer's or another dementia. So also African Americans are less likely to receive a diagnosis or are more likely to be diagnosed in later stages, and they're cared for by over 5 million family caregivers. African-American family caregivers. And one of the things that I do want to highlight here is that from the most recent Alzheimer's Association Facts and Figures report, they looked at discrimination, and one of the biggest barriers for African-Americans, over 50% of Black Americans identified that discrimination was a common experience in their interactions with healthcare. And so when we talk about some of the challenges with African-American caregiving, this is true. And I've actually found it in my work, which again, I'll focus on that in a little bit. Next slide, please. So I focus on African Americans. Like I said, not only is it because it's important to me and some of the work that I've seen over time, but African Americans are underrepresented or understudied in most research that we have on caregiving. And what we do know is that there are some important caregiving differences, and some of those include that caregivers begin caregiving sooner and they spend more time in the role. So sometimes it happens kind of insidiously. It builds over time. Maybe it starts with a few errands here and there, but over time there's more demand or more that's needed. African American caregivers are more likely to reduce their hours of employment. They're more likely to be adult children or also caring for others. And this can be other older adults, children, grandchildren. Many caregivers tend to be what we call sandwich generation caregivers, because they are managing older parents as well as young children, or caring for, not managing, sorry about that. I was reading the other part of that, but anyway, the point is that they're kind of straddling the fence with both individuals that could be needing care. African American caregivers are also managing greater dementia-related behaviors. So some of the common behaviors may be wandering, repetitive word or repetitive questions, things of that nature. And African Americans have been shown to manage more of those types of behaviors. And then finally, they're less likely to place family members in long-term care or nursing homes. And so with health disparities, these are well known in African-American communities, particularly in diabetes, hypertension, cancer, obesity, as well as multiple chronic conditions. And so all of these things together are why I focus on African-Americans and why I believe that this is an important group to focus on. Next slide, please. Next slide. So this is just a little snapshot of my work. And so I'll just kind of briefly describe it here. So my work has always been centered on African-American caregivers, using secondary data analysis. So basically there was data available and I looked at that data asking new questions of the data. For my dissertation, I looked at caregivers of persons living with dementia and dementia-related behaviors. That was one of the first things I did during my training. And some of the findings that I found even back then was the important role of caregiver characteristics when working with families of persons living with dementia.
So I was talking about some of the work that I had done for my dissertation, and then I moved into what I had done during my postdoc. And so through secondary data analysis of a lifestyle physical activity intervention, findings indicated that African Americans had positive evaluations, but their physical activity and positive affect decreased over time. In addition, when evaluating this intervention, responses for caregivers suggested that they valued access to resources and support. In addition to this, and I will talk more about this particular study, I also conducted individual interviews with African American caregivers, examining their experience of caregiving and perceptions of self-care, demonstrating a complex interaction of social, cultural, and environmental stressors, not only influencing how caregivers navigate their caregiving experience, but their health as well. And the reason that I wanted to highlight this work is because this is actually what led me into where I am now. It was after interviewing caregivers that led me to think more deeply about caregiving stress. I noticed that caregivers would say that they weren't stressed, but over the course of the interviews that were being conducted and the circumstances that they were sharing, which were quite challenging, I wondered what the difference was between what caregivers told me in terms of how stressed they were versus what their bodies would probably indicate, and then the role of resilience. So next slide. And so I want to share with you a few of the quotes that I have. So when you walked into his office, he had all of these Confederate flags. I just needed to know how me and my mom would be treated because of what it stands for. And that was from a daughter. Another caregiver said they think females should take care of their parent. For me, whoever can needs to take care of their parent. And that's how sometimes it all falls on one person or a certain individual because you expect this one to do that. And that was a son. If we can help it, we're not going to put them in a nursing home. We're not going to put them away to pasture. We're taught to take care of our own. A daughter. You've got to take you with you on this journey and realize that she'll be better or he'll be better off if you're good. I don't know why it took me so long to think about that. And that was a son. Next slide, please. This particular one, I don't know how she pulled it off, but somehow she connected herself to Mama's gas bill, and Mama was getting a bill for our address and her address. Everybody's saying you shouldn't take her there, you shouldn't do this with her, you shouldn't do this or that. Excuse me, that was a husband. I ignored myself many times. I didn't realize then that I was putting myself at risk. My social activities were pretty much gone. I just gave up being able to be out and about. It is hard. You start caring for someone else and you forget to care about yourself, the most important person. Next slide. And this is the last quote that I'll include. Not that it's fair, but sometimes I've always been taught that, is that as an African American, this is just as simple as this. You may have to take that local road where you stop at every stoplight, where somebody else may be able to take that expressway. You go into the same place, but you may have to take the slower route to get there. You just got to be prepared to be able to endure it, to be stronger. So as I read those quotes, I just want you to know that over the years, my work has progressively been able to demonstrate that caregiving for African American caregivers is more nuanced than what we've been seeing, what has been reported, and it needs further exploration, especially over time as caregiver needs change with disease progression. Next slide. Next slide. I mentioned after my interview that I really wanted to understand stress a little more and resilience. So I want to share a few more definitions with you. Actually, me navigating around my own screens here. All right, so again, this is just so that we're all on the same page. So stress is a threat. It's real or implied to the psychological or physiological integrity of an individual. And then another term that I want to share is allostatic load, and this is actually the long-term wear and tear on organ systems. And resilience is a multidimensional, next slide, please excuse me. Resilience is a multidimensional dynamic and protective adaptation in the presence of stress or trauma, and it's active resistance to adversity through coping. There's literature that talks about how resilience has been attributed to religion, social support, optimism, and coping in caregivers. Next slide, please. So stress for African Americans is an everyday experience, which may come as no surprise for many of us if you are living in this United States of America. Stress is associated with social inequities and systemic barriers such as discrimination, access to resources, and other markers of social disadvantage. Some of the coping strategies used to relieve stress, such as smoking or alcohol or other types of activities, may have long-term health consequences and may worsen allostatic load. The consequences of stress in African Americans have been shown to include sleep problems, immune functions such as fighting off infections, cognition or thinking capabilities, depressive symptoms, cardiovascular disease, cancer, and higher allostatic load. And this is particularly true in women. In fact, there's literature that demonstrates that higher education and income are generally protective of allostatic load for most groups, but not for African American women. Next slide, please. Now, when it comes to caregivers, specifically in thinking about stress, literature has demonstrated the detrimental effects of caregiving on caregiver mental and physical health. But as I mentioned, African American caregivers are underrepresented or understudied in caregiver research, and there's only a small body of work with inconsistent findings for African American caregivers for subjective stress, which is what people say. And then there's very limited evidence. In fact, one study for African American caregivers and objective stress, and that's what the body would tell us. Next slide, please. Oh, maybe I moved too quickly, excuse me. But all of this together pushed me to go deeper because the known effects of caregiving on caregiving health, the underrepresentation and understudying in caregiving intervention research, as well as the socio-demographic and cultural differences and burden of health disparities, for me, this indicated that this is a critical area that we need to look at and act sooner rather than later. Next slide. Next slide. So now I'm talking about my current research. So to see if the connections that I was making with the literature that I, kind of briefly described a little bit ago, I wanted to see if these connections were true. I was actually able to find a data set and examine 142 African American male and female dementia family caregivers to describe subjective and objective stress and health outcomes. So this work is under review right now, so I don't have all of the information to share with you because I can't yet. But I tell you what I did find was that what caregivers said and what their bodies were reflected indicated that something else was happening. And so, so you can see, hopefully you can see this, that they had disrupted sleep. Oh my goodness, I'm clicking on all kinds of things right here. They had disrupted sleep. They had higher depressive symptoms. They had moderate subjective stress. So again, subjective stress is what people say. And then they had high objective stress. And so the allostatic load that I mentioned, which is that long-term cumulative wear and tear on the organs, higher allostatic load. And I didn't mention cortisol, but cortisol is a common indicator of stress. And they had dysregulated cortisol patterns. What happens is that normally with cortisol, when you wake up in the morning, your cortisol may be a little high, and then it tapers off or it comes down throughout the day. But with caregivers, and what we know with caregivers in general, is that those stress levels, that cortisol level tends to remain high throughout the day. But for African American caregivers in this study, it was worse than what we've seen for general caregivers. Again, this is demonstrating that there was a problem that needed to be addressed, or that we needed to attend to this. And then finally, there were biomarkers that are associated with cardiovascular risk that were higher in this population. Next slide. Now, fortunately, I was funded to examine subjective and objective stress and resilience of African American caregivers over time. One of the drawbacks from the study that I just described that is under review is that it's only capturing one point in time. So I can't say what's happening over time or make any predictions of relationships to say that caregiving is definitely attributed to sleep. Caregiving is definitely attributed to depressive symptoms. So it needs more work, and we need to look at it over time. And so I've been funded to do that. And so while we know that caregiving is stressful and it continues for many years, caregivers, particularly African American caregivers, have been underrepresented and under-examined. And so we don't know enough about what helps to keep going, what's getting in the way, or how this impacts health outcomes, or what kind of other thought processes are happening for caregivers. Next slide. So through blood collection, measurements, culturally relevant surveys, and focus groups, my current work is an opportunity to examine stress and resilience in African American dementia family caregivers, to extend current research, eliminate inequities in health outcomes, and keep caregivers healthy. Next slide. All right, I'm actually making sure that I'm on the right slide. Okay. So I just want to revisit the stressors of caregiving, because we know that caregiving activities can be stressful, and it's not only because they continue over time, but it's also because, as I mentioned, and I didn't go into as much detail, but my paper really does talk about many of these inequities, but also because of the structural and systemic inequities that exist. the multiple roles that are being balanced, the fact that caregiving is so complex, not only just the provision of care, but also managing different dynamics, not only with the person that the care is being provided for, but also family members. I mean, and that's something that's not quite talked about as much, but I feel like we all know that it does pose a challenge sometimes. It's physically demanding. It takes up a lot of time. I mentioned that it's emotionally and financially difficult, as well as there's reduced privacy, as well as less time for, leisure, the fun that you may have. And it can also be unpredictable. And so just again, remembering that these are some of the reasons why caregiving can be stressful. And again, there are positive aspects to it, but the reality is that it does take a lot to be a caregiver. Next slide, please. So what might help is, and again, these are not guarantees, but I have all of these pictures. I hope it's not too busy, but the point is that, you want to plan for disruption, right? So the caregiving experience can be very unpredictable, and I do not want to minimize anyone's experience because I get it. I've seen it. I have not walked in your shoes, but I do understand the reality. And yet, if it's possible to plan for disruptions, because things will happen, pay attention to any patterns. That way you can try to start planning for those things. And one of those types of patterns to try to plan for might be maybe at a certain time of day, the person that you're caring for may be more tired, or maybe more, maybe more tired. We'll just stick with that for now. And so when you notice that, then it's not a good idea to try to plan activities during that time, because when they're tired, they may be less willing to participate in different activities. And so when you start recognizing those patterns, that can be helpful. And prioritizing what's most important, or even asking, is that what's most important? And the example that I'll give here is that I know at one point bathing can be a big deal, but sometimes the question is, is that most important today? Is that most important now? Is this the fight, if you will, or is this the argument that I want to have, or that we want to have today? Can it happen later on? Can it happen at 8 o'clock p.m. instead of 8 o'clock a.m.? Just thinking about what's most important. And again, my intention is never to try to minimize any of the experiences, but just trying to think about things a little differently. I mentioned that, caregiving is unpredictable, and so change does happen, and being able to match expectations with reality. And this is not easy. The person that you remember, the person that cared for you, is not the person that is sitting in front of you. And so being able to accept that person where they are, and to try to move forward with that, versus hoping for things to return back to what they were. Deal with what you're dealing with in the present moment. And again, I know that I don't want to minimize that is not easy. I do get that, but it's still a practice to continue. And changing strategies, remembering that success, and I use that in quotes because, successful is, making it through day by day, hour by hour, if we're honest, but it's all dependent on trial and error. And what works one day may not work another day, and that's okay. Just keep trying to find the things that do work. Keep trying new things. And again, as I mentioned earlier with the patterns of like sleep, if you notice that there's something that causes someone to be angry or agitated or less willing to participate in things, don't do those things at that time. If they eventually need to happen, try to figure out a way to distract or try to attend to it at another time. But it's okay to not do those things right in that moment. Okay, next slide, please. So I have some warning signs, because I think as we're talking about stress, it's just important to recognize some of the warning signs that you may need to take a step back, that it's becoming a lot for you. And it doesn't mean that you're not capable, but maybe you just need to, again, take a step back. So despite everything that you're doing, the persons that you're caring for, their condition may worsen or continue to worsen. that's a sign that maybe you need a little bit more help. Similarly, no matter what you do, it isn't enough. Again, these are things that can kind of continue to build up that stress. Feeling as if you're the only one in the world experiencing this, you are not. But if you do feel like that, that's a sign that there's a bit of overwhelm coming. And maybe it's not you, but maybe you know someone who's a caregiver and some of this is resonating. These are some warning signs. Maybe they don't have a place or a time to be alone, as I mentioned. Well, maybe I didn't mention it yet, but having that time to self is a little bit of recharge time to recenter and rethink and regroup. Next slide. So caregiving significantly interferes with work. Again, these are warning signs where you're not able to do, there's so much happening with caregiving that you literally cannot focus on your job. As I mentioned earlier, for African Americans, they're more likely to reduce their employment status because caregiving does take a lot. And so if you start to notice that, you can no longer work, that's another sign that it is becoming a lot. Feeling like it's selfish to think of yourself or your own needs. You're not selfish, first of all, or to encourage others that they're not being selfish. It is important to think of your own needs, but this is another sign that maybe it's becoming a lot. And that coping methods may be unhelpful. Coping methods may be more harmful. As I mentioned, some of the literature shows that over the long run, some of the choices that are made may do impact health, but in the moment it's helpful. But just remember that sometimes some of the coping methods or the choices that are being made may have long-term consequences, but there may be others that really are harmful in the immediate moment. And so it's important to recognize that that's a warning sign. And then finally, that there are no more happy times. So if you can still find joy in small things every day, that's an indication that you're, I won't say you're doing okay, but you're doing your best. But once there are no more happy times, when you're unable, or that individual that you may know is unable to find more happy times, that's an indication that the stress is starting to build up again. Next slide. So as I've shared some of the takeaway tips, I want to go into describing some, now that I've talked about some of the sources of stress and their impact, now I want to go into some of the takeaways of strategies. I've kind of touched on it a little bit, but I have a few more that are more specific. Next slide. So this should be the COVID-19 virus picture that you're looking at. COVID, I just want to say that everything I say moving forward is from the lens of the reality of COVID, which has changed everything. And so what I will say is do your best. That is enough. But I recognize that COVID has brought about such a challenge. Next slide, please. So again, the big takeaway is that it's important to take care of you. Put your own oxygen mask on first. Next slide. So again, taking care of you, I know, and again, I haven't walked in the shoes, so please excuse me. I'm not trying to say that I know personally, but I realize that finding time for self-care is a challenge. But self-care is critical because, as I've shown, some of the hidden consequences of this role of caregiving impacts not only physical health, mental health, but also emotional health. And with COVID and all of the inequities that it has highlighted, this has not lessened the stress. And so there are some things that you can do to care for yourself that may look different now, but the most important thing is to do what you can in the way that you can for as long as you can. The other piece is that to ask for help. Now, let me just say that I have struggled in the past with asking for help. So I know that asking for help may be a challenge for some people, but what's also a challenge is knowing when to ask for help. And that's why I highlight some of those warning signs, right? To understand that, maybe things are getting a little too much. So when those things are happening, start asking for help and ask. And be okay with the way that help looks. It may not look the way you would do it, the way you would want it, but that's okay, because the most important thing is that you're taking care of yourself and you're getting help in a way that is somewhat helpful for you. Next slide, please. So not trying to, make everything look all bright and cheerful or anything, because I know that it can be hard, or I realize that it can be hard. But I just want to highlight that support groups are one thing that can be done to begin to take care of yourself. They are an informal, safe place to talk. So many of those feelings that I talked about earlier in terms of grief and anger, guilt and resentment, some of those things may be really hard to admit outside to a close friend. But when you're in a support group, you're around others who are also experiencing or they're walking the same journey, and they know those feelings. And so it's a place where you can feel safe to be honest, but also to receive reassurance and encouragement without judgment. There is no shame in this, but that doesn't mean that those feelings don't still come. And so I just highly recommend support groups. Also, attending events like this one, just to keep learning more. This is a small way of just taking some time for you, taking breaks, doing something for yourself, whatever that looks like for you. I know caregivers that just having a long, hot shower, and I know we're in the middle of a drought and all of that, and I want to be sensitive to the climate. And actually, I am sensitive to the climate. I don't want to say that too dismissively, but maybe it's a shower. Maybe it's a nice, hot 5-minute, nobody interrupts you shower. Do that. Find that. And then along with that, find those moments of joy. And again, whatever that looks like for you. I think one caregiver that I had talked to was an avid gardener. And so whenever she would see like her new flowers bloom, or whenever she got a chance to prune her plants, she loved that. And she didn't get to do it all the time, but that was something that she really enjoyed. But whatever those moments of joy are. Next slide, please. So some of these next few things are going to be some things that are probably, I won't say commonplace, but maybe they are the same things that we hear a lot, but I can't emphasize it enough. It is still important to get exercise. Get whatever exercise you can where you're moving your body. I don't want us to get fixated on, well, I'm not a runner. And I mean, with wildfires and air quality and all of these different things that we have to be mindful of, it's important to be able to navigate exercise in the way that works for you. Maybe you're doing chair exercises. I have found so many great YouTube videos of activities and exercises online. They are amazing and simple, and something you can do in a short amount of time. But the point is that you're doing what you can for as long as you can, but moving your body every day. Next slide, please. Here, I just want to emphasize that, and I used a quote to illustrate this a little bit earlier, but going to those doctor's appointments, making those appointments, staying up to date on your health, taking care of your health needs. Again, with things the way that they are, maybe some appointments have to be pushed out a little bit, and that's understandable, but make the appointments and go when you're able to go. It's very important to do that. Next slide, please. So this is just a picture of just a healthy diet. This is actually, I think, the Mediterranean diet or the Mind diet, which is a combination of the Mediterranean diet. But the important thing is just decreasing some of the high fat, high salt, sugar pieces, and increasing grains and vegetables and fruits as much as you can. Next slide, please. And sleep it probably goes without saying. As I mentioned in my work, I've already found that sleep has been more disrupted in caregivers, which is understandable, especially if you may be caring for someone who gets up in the middle of the night or has a different sleeping pattern from you. But wherever you can get sleep, it's so important to do that. And I sometimes equated to babies. So when the baby takes a nap or when the baby is asleep, that's when you sleep too. And so just bringing it back to the person that you may be caring for. When they're sleeping, that's when you're sleeping. And I don't want to trivialize that it may be difficult because you're always on guard or hypervigilant about, you know, are they moving around? Are they in something? But just as a general principle, it is important to get some sleep. Next slide, please. And so here, I just want to talk about just staying social. Again, with COVID right now, things may not look the way that they always did, but being on Zoom, you know, FaceTime, if you have FaceTime, just making a phone call, but staying in touch with people to the extent that you're able, spending time with friends. Again, it's not so much what it is that you're doing, but that you're still engaging with friends or family members, or maybe your religious or faith communities. If you do have social groups or clubs, just staying in contact in the best way that you can, recognizing again that it may be a little more challenging now, but whatever ways you can find to stay in touch, that's going to be important too. Next slide, please. So again, my biggest takeaway from all of this, and this kind of captures everything that I just walked through, but the biggest takeaway is to really please take care of yourself. You are all doing great and important work, and I want you to be healthy and whole. And in order to do that, I need you to take care of yourself, recognizing that you're balancing a lot, but please do, it's really important. Next slide, please. So these are a variety of books by all African-American authors who I've met over the years, actually. I've just collected them. But these are individuals who have walked the caregiving journey. You know, you may recognize B. Smith. She recently passed away, but her husband, Dan, was her caregiver. And so he wrote a book. Well, they wrote the book together, but he was a caregiver. And as well as all of these different caregiver journeys that might be helpful to just help to normalize or to help you not feel as alone, or maybe even to pick up some tips that might be useful. Next slide. This is a booklet that is offered by the National Institute of Health, specifically the National Institute on Aging. It's a nice booklet. It's free. You can call, and I think they're still mailing things out that might actually look different now too, but this is another resource that's very helpful. Next slide, please. And I don't want to lose focus of, you know, your local Alzheimer's Association, local caregiver resource centers, wherever you may be, as well as the possibility of exploring either in-home support services or other service agencies that may be able to provide some help in some capacity. I'm still getting familiar with the in-home support services, but from what I understand, they are another useful resource. Next slide, please. Okay, so the remaining slides are actually a variety of websites and resources that you can go to for additional either information or just additional support. And so let's see, next slide is resources. And then next slide is a quote that I love. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. This is a quote by Rosalind Carter, and I just love that quote. And it just, to me, it just reminds us that this is why we care for caregivers, because they are us. Next slide, please. And I do want to acknowledge, first of all, I always acknowledge caregivers, because without you and the work that you do and being willing to share your stories and experiences with me, I keep them with me. I carry them with me, and it drives me to continue this work. Like I said, not only is it personal, but I've met too many, and I just feel like what you're doing is too important. So I acknowledge you and the work that you continue to do, and those who've shared their stories and those who will continue to share their stories. The next group of folks are my mentors that I've had over the years, and I am not even including everyone, but so many people have contributed to support me and guide me, because I think out of the box, and people have still been like, okay, let's keep moving. So I just want to acknowledge all of my mentors, as well as the funding that I've received to do the work that I've been doing over these several years. Next slide. This is my email address and phone number. If you are interested in learning more about my study or just to be in contact with me, feel free to email. And with that, I'm going to end here. That should be my last slide. I'm going to end here and I'm going to try to log in again. But if you have questions, I'm open to them.
Our first question is there a connection between the pre-existing conditions more prevalent among African Americans, such as obesity, diabetes, hypertension, and the onset of dementia?
Yeah, that's a great question, and I can hear you. I'm logged in, but so I'm seeing the screen and stuff, and I'm going to turn on my camera. But we don't have direct connection. So we know that obesity, hypertension, all of those can have downward effects, but we don't have definitive data yet to say that obesity causes dementia. We do know that vascular dementia, one of the other types of dementia, can be associated with it, but we're still conducting research. But in general principle, this is where healthy diets, quote unquote, healthy lifestyles, this is where it comes into play because we're still learning about where those downward effects come into play. And so it's better to err on, eating right, getting the exercise that you can, keeping your brain sharp, because some of those types of conditions do have negative consequences, but we can't pinpoint that it definitely causes dementia yet.
Great. And, again, that's, I think, why you shared the information too for us as caregivers, to make sure that, we have to put that oxygen mask on first and do our best. Day to day, it's going to be different, but doing our best to eating a well-balanced diet and having a lot of those greens and things like that, and good oils and things like that with the MIND diet or the Mediterranean diet. So appreciate you sharing that with us too, how to keep ourselves at the prime. So the next question is, in your research, have you discovered how much racism affects caregiver stress among African Americans?
So I haven't seen how much it does, but I know that from what I've seen, it definitely has an impact. And so that's why I'm actually looking to explore that in more depth. Nobody's looking at that, but that's the reality of the world that we live in. And it's a little sad that we haven't looked at it before, but that's where my work is going, to really look more deeply into it. I've certainly seen that it plays a major role. If you were to ever read my paper, many of actually, I don't even think I included all of the quotes because there's a certain amount of words that you can put into a journal article, but I have so many quotes from caregivers that talked about their experiences with racism. So I know that it's happening, but how much, I can't say just yet.
And we might hear about might get some feedback or a viewpoint from some caregivers who are actively caregiving right now with our panel after our break here. So after the question and answer portion. And then I think we've got, maybe 2 more questions here, and then we're going to take a 5-minute break. So our next question is, why are African Americans less likely to be studied in caregiver research? Which probably maybe correlates with the last question.
Yeah, that's an important question. So what has been said is that African Americans don't participate in research. And so that's why we don't know as much. And part of that is that not everybody knows about the research. And sometimes researchers will say, and I know I sit in the space of a researcher, but I'm trying to change the way things are. But sometimes people will say, oh, we can't reach them. We can't find them. And honestly, are you looking? Or are you really, what are you really doing is the question, because from what I've discovered, folks want to participate. They want to help understand what is happening, even if it doesn't always benefit directly. They want to know and to be able to contribute. And so what has been said is that they're not willing, but I believe that folks are willing, but we just have to do more in order to bring them in and engage people. So that's a huge piece.
Thank you for that. I'm not sure if you found this in your research, but our next question is caregiver burnout more common among African Americans, probably compared to other race backgrounds?
I'm sorry, can you say that first part? I was switching something on my phone.
Yes, absolutely.
Sorry about that.
That's okay. Is caregiver burnout more common among African Americans?
Oh, that's a good question. So this is going to be totally anecdotal. I think yes. I think yes, but because of the many different things that I've started to see in my own research that, you know, that contribute, that add on the extra layers on top of just what caregiving is, but I don't have definitive data to say it's more common in African Americans just yet. And that's where I'm hoping my work can go, is to be able to show, and not just, I mean, I hope that we will start exploring all of our communities of color, because that's the challenge right now, that so much of the work that's out here is about white caregivers. It's important to understand with caregivers, but we have so many diverse communities of color out here, and what is happening, we don't know. So I can't say that it's worse in Black caregivers. There's some data that does start to look that way. Some of my work does start to look that way, but we can't make those definitive conclusions just yet.
Thank you for sharing that. And we've got one last question. I don't see anything else in the chat, and I don't see anyone's hand raised at this point in time. But again, thank you so much for your time today. And so our last question, then, if we don't have anything else coming in, is what resources have been most helpful in supporting the caregivers you've researched?
Pardon me again, excuse me. So that's another good question. All questions are good questions. So caregivers who could attend support groups found support groups to be helpful when they were able to have respite care, someone to come in for a little while where they could take a little bit of a break. That's been helpful. But unfortunately, with the caregivers that I talked to, many of them dealt with so much discrimination where so many of those resources were not available where they were, or didn't come to where they were. So many caregivers found other ways. And so, you know, that was where they tended to, you know, sew or knit or pray, read the Bible. You know, they had to rely on other sources versus some of the formal sources that are available. But those that were able to access them, those were helpful for them. Like I said, the support groups and or respite care, the Alzheimer's Association having materials, but again, some of the caregivers just, it wasn't in their area. It was too far. They didn't come to that area. So.
And there's definitely, you know, growing that network of care for a caregiver, you know, if it's friends and neighbors, persons from a church, you know, your church, your synagogue, you know, those kinds of things too. So, and I'm sure that if it hasn't been shown up in your research, as you say, continuing to do that, that will probably start to shine. And hopefully, like you said, attending education programs like we've had today. We would love to have more people attend a program like today. You know, trying to find the right time of day to do workshops like these as well is always a little bit of a challenge, trying to find how long that people want. So it is all a challenge. I know that we're all trying to do our best, and I recognize some familiar names on our call today. So with that, again, I don't see any other, I see a lot of kudos and thank yous, Dr. Cothran, but I don't see any additional questions. So at this point in time, just really thank you so much for this first portion of you with us today and your presentation on your research.
All right, everyone is here. I'm so excited for this portion of today's presentation. We just got a wealth of information from Dr. Fawn, kind of the context. It set the scene for this discussion. And now I want to take a moment to introduce our two panelists. Angela and Leon are both from the Greater Sacramento region, and both are caring for adult parents with a dementia diagnosis. I'm going to start with Angela, just give you a little background on her. She was born in Alabama and is the youngest of 9 children. She's been married for about 21 years, has 1 son and grandson, and is a teacher, God bless her, at Sac City Unified School District. She's been teaching for 27 years and through all of the craziness of the recent pandemic. So we are so pleased to have her here. She's going to talk to us today about caring for her 90-year-old mother who lives in the Bay Area. So she's providing care at a distance. Leon, who was born in the Bay Area, is a native of San Francisco, but currently lives in Sacramento, is also caring for his mother. He works for the state of California and has simultaneously been providing primary care for his mom for the last 9 years. So he's a working caregiver. He's very active in the Alzheimer's Association and has served on their planning committee for the African American Forum and for advocacy days at the state capitol. So welcome, Leon and Angela, and I'm going to turn it over to Dr. Fawn.
Thank you, and welcome again to our panelists and this next part of our morning together. So I will kick us off, and I'm going to do this according to how you all appear in my little Zoom boxes. But the first question I have for you are, Leon and Angela, where are you in your caregiving journey? How long have you been caregiving? And we'll start with Leon first, and then Angela, if you don't mind going after.
I've been caregiving in one form or another since 2011. It has definitely been a journey. My mother lived in San Francisco when we first started. You know, she was losing weight, and family was concerned, and nobody knew why. Eventually, we found out that it wasn't cancer, it was dementia. She was having issues with burning food and just things that come along with having dementia, you know, as far as caring for herself. So started the journey simply by paying bills, because she was forgetting to pay bills, and it's been a journey since then. Eventually, we had to move her up to Sacramento and you know, place her into assisted living and now memory care.
Thank you. Angela, where are you in your caregiving journey, and how long have you been caregiving?
So good morning to everyone. I'm really glad to be a part of this panel today. I'm recent in my journey in caring for my mom. I live in Oakland, and I left Sacramento at 7:30 so that I can be here with her this weekend. So I'm fairly new. It's been about almost a year. And we can see the progression happening right before our eyes. But so I'm fairly new, but it seems like a lifetime.
Thank you both. Some questions about some of the challenges that you may have experienced. Can you tell me a little bit about the most challenging part of caregiving? And this time, Angela, I'll start with you, and then we'll move to Leon.
Well, for me, it's being so far away from my mom. That's the biggest thing. And also just, you know, knowing the person who I've always known, to see the change in her. And also, you know, the lack of support from within, like with family, and to see, you know, we're not all coming together. So that's been a real challenge for me. And just to yesterday, I talked to my mom, and she was in high spirits and excited that I was going to be here today. And then this morning, it's a different attitude. So that's been very tough to handle. But I'm learning slowly how to change with her, and to take deep breaths or walk outside. So that's been a real challenge. The lack of family togetherness and support for her, and being so far away. That's been a challenge.
Yeah. Thank you. And it's okay. Yeah.
I can definitely relate to those emotions. For me, the major challenge is my mother comes from a large family. She has 10, 11 siblings, but I'm her only child. So just trying to take care of everything. You know, I'm grateful that we're in a position for her to be in a facility. I know as an African American community, that's kind of a, you know, we don't do that. You know, I've heard that, and so for me, just being the only child, trying to take care of everything, just trying to figure everything out, wondering if I'm doing right by my mother. You know, the guilt that comes along with, you know, feeling like am I doing the right thing? I've had some support, mainly through support groups and, you know, other caregivers and you know, with the Alzheimer's Association and my wife. But, you know, when it comes to the family, I have to be honest, you know, I always feel like they look at me like I'm doing something wrong by having her in a facility. But the way my life is and was when this caregiving journey started, it just made the most sense. And, you know, I'm a father, I'm a husband, and I'm a son, and an employee, and my career takes up a big part of my life. That's a big challenge too. So it's just hard to pinpoint one thing that's the major challenge, but just trying to keep everything together is very challenging.
And I just want to kind of some of the things that Leon said. Leon, although you're the only child, there's 8 of us. And sometimes I feel like I'm the only child. A friend of mine shared with me the other day, which helped me, and she said, many are called, but few are chosen. Meaning I have many siblings, but I've been chosen. And I think so that when I come here, I think I see things that she needs that my siblings just totally overlook. For example, just cutting her toenails or cutting her fingernails. My mom, as a child, she used to have the ingrown hairs under her chin, and I would see her as a child get the tweezers and pick them. And I noticed that a few months ago. And now I'm like, come on, Mama, because I knew that's something that she always did. She didn't like that. And I say, well, don't my siblings see that? They have to see that. So Leon, although you're the only one, I can tell you it's not guaranteed if you had many siblings that it would feel any different. That's been my journey.
And I'll just say also that, you know, just from the research that I've done and the interviews that I conducted with caregivers, that is not uncommon to, you know, either have a support system who doesn't quite step up in the way that you would expect them to, but also to have folks who are a little more on the periphery make judgments about the calls that you need to make that are best for the person that you're providing care for. So I also want to just kind of level set and normalize that you're not alone. I think it's wonderful that the two of you have similar but different experiences. And I just want to share that came up so much. It is not uncommon, and you always have to do the best thing for you and the person that you're caring for.
Fawn's video has frozen. I'm just going to pick up where she left off with her question. So Leon, we'll start with you this time. You know, what rewards of caregiving have you experienced in caring for your mom? We understand the challenges. What are some of the rewards for you?
Some of the rewards I would say is it's kind of hard to say. I want to say getting closer to my mom and, you know, being selfless and taking care of her, because I appreciate how she took care of me. So, you know, there's that. But at the same time, it's still a loss because, you know, trying to be close to her is difficult because she's not that same person that she used to be, and it's been a journey. But you know, I guess another thing is just making sure she's all right. When she was in San Francisco, you know, she was in a place that she had been for 35 years, and I didn't want to displace that. You know, I wanted to, you know, one thing that I always try to do throughout this journey, that's now 10-year journey, is just focus on her dignity and make sure she is not, to the best of my ability, never disrespected. You know, I try to never disrespect her, even when things get frustrating sometimes. So to me, the reward is just making sure she's treated with the respect that she deserves. And that I'll make sure.
Thank you for that, Leon. What you said really resonated with me in my own caregiving experience as well. And I think that the operative word is dignity, right? Like we want to ensure that, you know, our loved ones can age with dignity, and regardless of the diagnosis, regardless of how it changes them. We want to take care of them the way that they took care of us, if at all possible. So I see Dr. Fawn has rejoined us. Hi there. I'm just gonna pass it over to Angela now. Same question. What are some of the rewards of caregiving that you've experienced?
Yeah, so I agree with a lot of things that Leon said. What's been my rewarding moments is like my mom loves See's candy. And so when I come, I bring her a little box, and to see the smile on her face, I'm learning to take the little things and accept those as rewards. I told her today all the food I cooked last night, and to see her smile and say, "Oh, really?" You know, that's rewarding. That makes me feel good. And also, you know, just being able to take care and look at details. It's rewarding for me to know that I have that eye to see that my mom needs a handrail, and I can just Amazon it to her house. Those things are in and out. Hello? Okay, I'm good.
You're good.
So those things are rewarding to me. And when she has her really good days and capturing those moments, I treasure those. And I remember, someone shared with me, even on the support group, is create new memories. And so that's been rewarding, to create new memories with my mom. And so I'm trying harder to look at things in a more positive way.
And if you don't mind, if I can just say one other thing, is
Please.
I just value those moments that we have when she says something funny or she laughs at something that I say. Those are just so valuable now, just sharing a laugh with her. So that's definitely rewarding.
Yeah, and same here. Like when I come, I put on Aretha Franklin for my mom. And to see her go back, those were her happy days. And she says to me, there'll never be another Aretha Franklin. I'm like, Mama, you are so right. She said, they're trying, but So when different songs come on, like the Cleanup Woman, and she just smiled, so those are rewarding moments because she's smiling and she's laughing. It brings back, earlier years of our times together. So, you learn how, and I'm learning how to take those as rewards. So thank you for that, because there's so much that you're dealing with that you really don't stop to smell the flowers, the roses, those rewards of the laughter that you hear or the joke that she tries to make, So thank you. I needed that.
Thank you. Thank you to both of you for your honest responses. And again, it kind of brings me back to my own caregiving situation with my mom and those tender moments. I think that we have Dr. Fawn back on. I'm going to turn it over to her, and she's going to continue with our next question. Thank you.
Okay, thank you. Thank you, Simone. Again, my apologies. This is the life we live. So we talk about resilience and flexibility. My goodness. Anyway, so thank you both for sharing some of the rewards, what I was able to catch when I came back in. Hopefully this may or may not have come up, but can you speak about how did you know that you were at the point of needing help? How did you ask for help, and where did you go? Angela, yeah, thank you.
So I'm going to be honest, although just been shortly caring for my mom, I was in denial. And I quickly got over that. And once I quickly got over that denial and say, hey, okay, like this is what it is, I started to reach out and tell other people of what I was experiencing with my mom. And then I would get other connections from that person. And I talked with a lady who lost her mom to the disease just last month. And, she really helped me to understand, the progression and to start doing my own homework about it and learn about the disease. And that has really, really helped me in this journey. So I knew I needed help when I was in denial, because I had to get past the denial and go to the acceptance and then move forward. And so the help came with logging on to Alzheimers.org and signing up for this care support that you said, Dr. Fawn. Sleep has been my biggest one. Like, I can't turn my mind off. I'm always thinking about my mom and me being so far. So I knew that was not normal, to not be able to just turn the mind off and go to sleep. And so that's when I had to really just reach out and find a support group. But my biggest support has come from God, having those conversations with him, and him through his word and his Holy Spirit letting me know it's going to be okay. Enjoy the moment, enjoy the journey. You're not on it by yourself. But I had to come to the point of acceptance in order to reach out and get the help.
And for me, as far as getting help, I'm not sure if this is as a caregiver or getting help from my mom, but yeah, when our family basically said, hey, you need to figure out what's going on with your mom, and then, you know, there's the process of just going down there more often and seeing what was happening, and then taking her to a doctor's appointment, and then eventually having the diagnosis of dementia. It was mind-blowing because I had never knew of anyone in our family or just, you know, anyone close having that diagnosis. So I didn't know what to do. So it was like, what do I do now? So I started asking questions, and you know, those questions led me to where the resources are, first in San Francisco and then eventually out here. So yeah, that's how I knew that I needed help. Was just dementia and Alzheimer's was just something that I knew I wouldn't be able to figure it out. I needed all the information and help I could get.
Yeah, I think it's great that you were able to, you know, make use of what you could. And Angela, just from my own work, it's not, I think it might be actually in my study itself, but you know, a lot of folks relied on God, the Holy Spirit, to kind of carry them through, in addition to different resources. And so yeah, asking for help doesn't always mean like people, but also who do you rely on in terms of, you know, what faith-based do you rely on? We've started to touch on some of the family dynamics, and so, but I do just want to ask, and Leon, maybe you can, and I don't mean to keep putting this on you, but Angela's assisting her mom right now, but can you share about how you have negotiated those family dynamics? So I know you mentioned that you're the only child, but how can you speak to how you have negotiated some of the dynamics with relatives who may have wanted one thing and you did what was best for you in the moment? Can you speak to that at all?
Sure, I can. And also, I just wanted to, you know, say to Anissa that the circle gets smaller. That's one of the things that I heard. And that's another painful aspect of the dementia and Alzheimer's journey is, you know, that wide social circle that our loved ones had becomes a lot smaller. And, you know, maybe part of the being mean is just protecting herself. But the circle does get smaller. And then as far as navigating things, you know, maybe the fortunate side of being, the fortunate side of being an only child is I don't have to negotiate with siblings on decisions. So that's the positive side of it. But, you know, like I said, my mom has a lot of siblings in the Bay Area. And one of the things I've had to navigate with family dynamics is some of them don't know how to talk to her. And some of them, you know, they think they're just being light with her and like being funny and fun with her, but it comes across as disrespectful. It chips away at her dignity when you make jokes about, do you know who I am? You know, and oh, do you remember this? Knowing that she's not going to remember it. And personally, I'm not a real confrontational person, so the things I have to navigate is, do I want to put my mother in these situations when some of the family members don't treat her with the respect that she deserves? But at the same time, the Alzheimer's is already so isolating that I don't want to purposely keep her away from family functions, because family reunions is a important and prideful tradition that we have as a family. We've had family reunions since the 70s, and that's one thing I try to do, is make sure she makes it. So sometimes I just have to keep her away from people who aren't going to treat her right, and and then, but still make the function. So those are some of the things I have to negotiate with.
Thank you. Angela, would you mind, welcome back, by the way, would you be able to share how you have negotiated caregiving, if you're comfortable doing that?
Yes, so I want to thank you guys for your patience. I am the only one with my mom this weekend, and so I'm multitasking. This morning, she didn't want to get dressed or take a bath, and just now walked out. She's in the other room, like, what are you doing? Finding me some clothes. So, I got to make sure she's okay. But anyway, the one good thing about negotiating, I think, like her business and financial things, my sister started that shortly after my mom's husband passed. It's about 6 or 7 years ago. So she takes care of the mortgage. Her name is on my mom's bank account. I'm on one of the bank accounts. So that part has really been a blessing. Although sometimes my mom likes to listen in on what I'm talking about, so anyway, can you hear me? Leon, can you hear me? Okay. So yeah, I'm sorry, because, so anyway, that has been a blessing as far as the finance, because I do have a sister that takes care of that, that part. That hasn't been an issue as of yet. So did I answer your question? My mind is in two places right now. My mind is like, Mom, I hear out there wondering, and I want to participate in this. And that's the other thing with this disease. Like, you never know how the day's going to go. You never know from minute to minute how things are going to transpire. So like when I'm here with her, I sit there across from her. Otherwise, can I tell you guys a quick story? Is that okay? Just in Oakland on the street, this guy in the middle of her street was doing donuts. She's ready to run outside to tell the guy to do donuts. I have to push her away, like, Mom, you can't do that. That's not safe, but that doesn't register in her head. She's ready to go out there and shoot him, she said. Mom, you don't have a gun, but if I had a gun, so those things gets my blood going, so I hope I answered the question correctly.
Thank you, Angela and Leon. And I just want to thank Dr. Fawn. We're still having some tech issues. So I'm going to take over moderating from here to the end of our panel. We've got another 5-10 minutes left and a few more questions to cover. Angela, I think you did answer that question beautifully. And just as a follow-up, how do you feel like communication with your mom has changed since you've become a caregiver?
Wow. Yeah. Like today, I can be with my mom all day. And then when I think it's sundowners hit, she looks and says, "Who are you?" Now that hits me to my core, because I'm like, we've been together all day, right? When that first happened to me, I think that helped me to snap out of denial. I'm like, I've been with her all day, and just, it's 6 o'clock and now she doesn't know who I am. So I've learned how to just say, "Oh, Mom," she'll say, she'll say, "Oh, well, who are you?" And I say, "Oh, I'm Angela. I'm your youngest daughter." And she'll laugh, "Ha ha ha. I'm really going crazy, huh? I said, oh no, Mom, you're okay. I'm your baby girl. I'll make a joke out of it sometimes. I'm the last one you pushed out, Mom. The last one you pushed. And you did a great job pushing. You pushed me on out, and here I am. And she'll, oh, I try and make light out of the communication. My mom is the last living of 14 siblings. Mm-hmm. And when I was here 2 weeks ago, she told me that her brother is still living. And I'm like, no, Mom, he gone. And I look at her and say, you know what, Mom? You're the only one left. So I'm learning how to get better with communicating with her, knowing, trying to remember to say, oh, Mom, will you remember? I'm trying to really think about the words that I say before they come out of my mouth.
Yeah, I really appreciate that. Leon, have you found that you've had to change your communication style as well, and when you visit with your mom?
Definitely. In the beginning, I did everything wrong. In the beginning, it was hard to accept that, she would say things like, oh, somebody broke into my car and they changed out the battery. And it's like, who would do that? Or, her landlord would come down and like purposely mess with her TV. So she had these things going on that didn't make sense, and I would try to like reason with her. It took a long time, and I learned the hard way that you can't argue or reason with a person with Alzheimer's. So the communications definitely changed. And to be honest, though, over the years, she's had Alzheimer's a while now, and this COVID pandemic has really created a decline. So, she hasn't had a chance to go to her religious services in a year and a half. And so her communication isn't what it used to be. So she's verbal, but she's not as verbal as she used to be. But over time, yes, I've had to change my communication style. I had to learn how to just be where she is. And that is so hard. But it's necessary, because why spend all that time arguing over things that we know is true, we know what's logical, she just doesn't know, and that's okay. I had to learn how to be okay with her thinking something that wasn't logical.
Leon, I think that's so well said. And I just want to thank you both, right? Like, as caregivers, you have to adapt, right? Like, this is as much a learning experience for you as anybody. And, Angela, I think you said something earlier about I didn't know what I was doing at first, or something along those lines. And I was just thinking, do any of us, do any of us know what we're doing when we become caregivers? We're constantly learning, right? My last question for you as we start to wrap up the panel kind of has to do with self-care. And Leon, you mentioned with your mom, given situation with COVID, some of her outlets for socializing have been taken away because of sheltering in place and all of the safety protocols. And that certainly has an impact on her. It has an impact on caregivers as well, the limited outlets for self-care. So I'm curious how you both have been able to engage in taking care of yourselves as the caregiver, especially during this difficult time. And I know that's it's a hard question to answer, but Angela, we can start with you. What do you do to take care of yourself?
First, I have to start with the self-care of not only in my car and ride and be here every day, then go back to work every day. I feel, I have to let go. So for my self-care, I'm learning how to let go of some things. And I'm learning how to say, Angela, it's not only you have 7 other siblings, but you do what you need to do for your mom and take care of yourself. I've also, with self-care, I'm learning how to turn my phone off at night. And because on my phone, we have cameras in the house, my mom, and then we have the Ring, all of that is on my phone because no one else wanted to do it. The other self-care, I do walking. I do an hour walk, which gives me 3 miles. So I really, really do self-talk to say, go out and go walk, and do Zumba twice a week. So that really helps me. And of course, nice long baths and showers and music, because I realize that if I'm not well, I can't help my mom. And so I have to take care of myself and learn that it's okay that I do that, because that's the only way that I'm going to sustain my health and mental and emotional and spiritual health on this journey.
For sure. And Angela, I love that you're incorporating regular exercise into your self-care. Later in the program, we're going to talk about how that's important. And I know Dr. Fawn has already mentioned that that's critical with regards to healthy aging, and your boundaries with technology. I mean, it's really hard to have boundaries with technology right now because technology is our way of staying connected. But there's a point when you got to turn the phone off. You gotta, make sure you get back to basics with your sleep, good sleep hygiene. Thank you for that. Leon, how about you? What are some things that you've done to engage in self-care?
Self-care is definitely a challenge for me. I tend to get stuck. I work from home. I've been trying not to go out and expose myself too much, because if I get the virus and I pass it on to my mother and she passes it on to other people in her facilities, I would feel horrible. So self-care has been really challenging. But when I do self-care, it's when it wasn't safe to even go outside, I would walk the stairs. When I do self-care now, it's going on walks in the neighborhood. If I can get an hour in, that's great. But usually I don't. And then also lately, taking drives to the Bay Area. We're trying to find a different spot that we could go on walks, me and my wife. And so just going, we went to the Berkeley Marina recently. We went to Sausalito recently, just to get away, especially when the fires are bad out here. The air on the coast seems to be cleaner and clearer. So those are some of the things. And I like what Angelia said about music. Music always lifts me up.
And you may be aware of this, but music is pretty critical when it comes to activating long-term memory, right? There's this beautiful documentary, and I believe it's called Alive Inside, that documents how music can be a way of connecting with people who have Alzheimer's, who may be nonverbal, with drawing them out, with giving them a space to engage in some meaningful activity. And Angela, I remember your story about Aretha Franklin with your mom, right? Like, what a beautiful way to connect with her, and to take care of yourself simultaneously, right? Because I know for me, I like to blast Aretha Franklin when I'm driving home. I really do. Well, we're at the top of the hour now, and we're going to need to transition into our final break and the last piece of our program. But I just want to thank you both for being here today. I want to thank Dr. Fawn for facilitating, and in spite of all of the tech issues that we've had. And I'd like to end just with some words of wisdom from both of you. What would you say to, in a sentence or two, what would you say to someone who's maybe beginning this journey or is just realizing that, you know, they need help in caring for their loved one, based on your own experience?
Well, what I say to myself as a reminder, when I get to that point, I say, Angela, you're not on this journey alone. There are many other people on me down, because sometimes I feel like, oh, it's just me, you know, but I have to tell myself, you know, I'm not on this journey alone, and there is support and there is help, and be patient and prayerful on the journey. Because also I say, God chose the journey. And he knew I could handle it with him. So I have to remind myself that too. And sometimes I tell him, you have a way of doing things, you know, God. And, but I know, you know, I tell him what he said. When I get to that point, I tell him what he said in his word. You said, you'll never leave me nor forsake me. You said, you'll fight all my battles. You said, I am the head and not the tail. So those kind of things help sustain me. And hopefully that can be a help to someone else. You're not on this journey alone. We were chosen. And so we're going to win in the end.
I love that you can impart such strong words of wisdom with regards to your faith and just this idea of fellowship, right? Caregivers are more numerous than you would think, but somehow we when we're going through it, we feel alone, but you're not alone. I love that. Leon, final words?
First of all, thank you. Thank you for allowing me to participate in this. And it's therapeutic for me to be able to express this, because, you know, I tend to just kind of keep my feelings to myself and keep things to myself. So thank you for that. Thank you, Dr. Cothran, for doing the research and caring about us as caregivers, and putting so much time and effort into, you know, researching us and figuring out how to help us out. And I think for everyone else, places like this are a great start. Nobody understands what we're going through, you know, like we are, you know. So before my mom got Alzheimer's, there was no way I would understand. You have to be in it to understand it. So this is a great start, and things like this help me out. Presentations where I learned about Alzheimer's, and then support groups where we could talk to each other, and I could find out that I wasn't crazy. You know, the things that I was going through, other people were going through too. Is just so valuable to me, and it really helped me out. So I love what Angelia said about just reaching out, and you can't do this alone. Doing it alone I don't think I would be alive today if I didn't have support, because it was so stressful. So keep learning and keep being a part of groups like this. And I think that would definitely, that's my words of wisdom.
Thank you for that. Again, I want to, I've been trying to send you both messages, private messages, just to thank you for your words of wisdom, but I'm just going to speak it out loud to the group. We appreciate you, and thank you for being a face for caregivers. This is not an easy job, and a lot of times, you know, that we enter into situations that are caregiving situations that are so complicated, whether we're only children, whether we're from a big family. But it's good to remember that there is a community of caregivers. There's a large population of caregivers across the state of California, across the United States, across the world. We're not alone. And the work that we're doing, as Dr. Fawn mentioned earlier, is critical. It's really, really critical. So I want to thank you guys again for your time. At this point, we're going to end our panel for today. I hope you both have an opportunity to engage in some self-care, go on a walk, listen to music, do something kind for yourself.